Hi, and welcome to this mini class on HPA axis and hypertension. Nearly half of the US adults have hypertension. While medications are often necessary, side effects like fatigue, dizziness, and sexual dysfunctions are very common. So what if we can improve your clinical outcome by addressing the underlying drivers of high blood pressure and reduce the potential side effects by combining a functional and integrative approach? So that's exactly what we're going to talk about in this short video. So when we talk about high blood pressure, we often think about salt, excess body weight, or genetics. But one of the most overlooked drivers of hypertension is chronic stress and HPA axis dysregulation. And today I'll show you exactly how stress physiology can push blood pressure higher even when the patient's labs look normal. So let's start by talking about what is the HPA axis. I'm going to draw it over here so we'll have a very clear visual of it. So the HPA axis, also referred to as the stress regulation axis. So here we got the H for hypothalamus, P for pituitary, and A for adrenals. Now the HPA axis is our main stress response system, and its job is to keep us alive during stress. Now, the way that it works is every time we have stress, it activates our HPA axis, leading to the secretion of cortisol. The other one is adrenaline or noradrenaline. And this system, when dysregulated, can contribute to high blood pressure and other vascular damages I'm going to show you here in this short video. So let's talk about mechanism number one on how stress leads to high blood pressure. So the first one is very simple. This is the secretion of epinephrine or norepinephrine from the adrenal medulla. So let's say this is the outer layer of the adrenal and this is the adrenal medulla. So every time we have activation of the stress response, we essentially have the secretion of adrenaline and noradrenaline. What adrenaline does is elevate our heart rate as part of the sympathetic response, also elevates our cardiac output, and activation of the sympathetic system also essentially leads to high blood pressure. Of course, this system is limited to typically several minutes because for example, adrenaline has a very short half-life, right? In the plasma, it's about 1 to 3 minutes. However, what I want you to think about is with patients that constantly experiencing stress throughout the day, this oftenly or overactivated or triggered mechanism can have a low long-term impact on your patients. So it's kind of like striking a match. It burns up quickly, but if you keep striking matches all day long, your room keeps filling up with smoke, right? So let's dive into the more longer term impact on blood pressure, on our patient's blood pressure. Mechanism number two is the secretion of cortisol. And this is secreted from the outer layer of the adrenal gland. So here we have secretion of cortisol. Cortisol have an impact on vasoconstriction of our blood vessels, and this is through two major mechanisms. And what essentially this study from early as 1998 found out that after accounting for dietary sodium and gender, higher urinary cortisol levels were found to be associated with essential hypertension. So let's dive in deeper into the two mechanisms of how chronic secretion or higher secretion of cortisol can contribute to blood pressure. So the first mechanism is the impact on our alpha-1 adrenergic receptors. So let's draw this so we have a better idea of how this works. So let's say this is our blood vessels. On the blood vessel, let's say we have a receptor here. Every time we secrete cortisol, if you have oversecretion or chronic secretion of excess cortisol, it increases the expression and sensitivity of the alpha-1 adrenergic receptor. So this receptor increases in sensitivity. This receptor that sits on the vascular smooth muscle increases sensitivity, which makes the blood vessels more responsive to catecholamines such as epinephrine, norepinephrine, which lead to vasoconstriction, right? Because now we have higher sensitivity to adrenaline or noradrenaline. So that's one mechanism. The second mechanism is the impact on nitric oxide. Under chronic exposure to excess or elevated level of cortisol, where the body goes through suppression of the endothelial nitric oxide synthesis activity, which leads to reduction in nitric oxide, which is a key vasodilator. So if you have reduction in NO synthesis, you are essentially, it could lead to vasoconstriction. It also increases oxidative stress, which further degrades nitric oxide. So we'll do reactive oxygen species as a result of that as well. Now, reactive oxygen species also lead to inflammation, and this is a key player in atherosclerosis. So let's take a look at this interesting study that reported that a physiological increase in cortisol significantly reduced endothelial nitric oxide synthesis expression in human endothelial cells. And now we're going into, so this was so far the impact on our vascular, right? Through their impact on the receptor, through impact on the nitric oxide production, and the elevation in reactive oxygen species. Now, another mechanism is through the regulation of the immune system. So let's say, I'm going to draw it here. Let's say this is our immune system. This is our immune cells. Excess secretion of elevated level of cortisol. Remember that cortisol has an anti-inflammatory effect. It inhibits several inflammatory pathways. And on our immune cells, we have the glucocorticoid receptor. So here, I'm going to draw it here, we got the glucocorticoid receptor. So let's call it GR, glucocorticoid receptor. Cortisol will essentially bind into this receptor, which inhibits certain inflammatory pathways, and it's our body's innate way to reduce inflammation, reduce ongoing chronic inflammatory situations. Now, the problem with that is if you have overactivation of those receptors, they become less responsive. They lose their sensitivity. And so that leads to cortisol binding that is weaker, or the signal becomes weaker, which essentially causes certain component in our immune cells to become more active. And so certain transcription factors such as NF-kappa beta, kappa B are no longer suppressed. And then what that leads to is the immune cells continue to produce inflammatory cytokines. So we got monocytes, you got macrophages that keep releasing interleukin-6 and tumor necrosis factor alpha, which are inflammatory. So again, now we have contribution to this inflammation. And some of those inflammatory cells, inflammatory cytokines, interleukin-6 or tumor necrosis factor alpha, increase the damage to the blood vessels, which is a major contributor to atherosclerosis. Just here, in this drawing, I know there's a lot going on here, but it's showing you several mechanisms that contribute to blood pressure in the short term and in the long term. And so here's another interesting study that showed that greater cortisol responses to mental stress were associated with progression of coronary artery calcification, which is a marker of subclinical atherosclerosis. Unfortunately, most providers in the standard of care do not address the underlying physiological factors that contribute to blood pressure. And so that's why so many patients, even on medication, continue to progress and develop cardiovascular diseases or need more medications over time or lose function. If you understand functional medicine and integrative medicine, you have a broader understanding and a lot more tools you can utilize to help your patients. So let's take a look at it as an example of some of the treatment protocols that we might consider combining or integrating into the standard of care, or as supportive, or in some cases with mild elevation of blood pressure, maybe as an alternative. First we want to do is manage the stress response. So if we go back to looking at this graph, what activates the HPA axis and secretion of the adrenaline, noradrenaline, and cortisol is stress. So if we address stress, if we manage the stress response with our patients daily, we can assist the body in the regulation of this system and reducing the overactivation or triggering of that fight or flight responses. The second thing is physical activity. Even just 15 minutes a day, and that's how we start. Small steps to achieve over time, long-term, greater results. So I would ask, for example, my patients to, after lunch, to take a 15 minutes walk around the block every day, just to get things moving, get them in the habit of movement, and slowly increase that in duration. We can also use botanical support. So this is a more integrative health approach. Botanical supports, we have several powerful tools that we can consider using for both reducing anxiety or stress, for regulating the HPA axis, for supporting reduction in blood pressure. I'll give you a few examples such as holy basil extract and ashwagandha. And dietary factors are really important. For example, the DASH diet. There are multiple studies on the DASH diet. And then nutritional strategies, which I'll give you a few examples in a minute. I also wanted to mention phone apps. There's a lot of phone apps we can use. Using technology is easy and simple and very affordable. I'm going to recommend you 3 of those that are free to use. So you got Smiling Mind, which is completely free, with structured mindfulness programs from 5 to 30 minutes. You got the app by UCLA, Mindful, which is a research-informed mindfulness tool. And then you get the 10% Happier, which is an app that have different mindfulness experiences, and your patients can try those. Now let's go back to talking about the supplementation, which is often the simplest, very affordable way for patients to support reduction in blood pressure. So here's an interesting study. 8 weeks consumption of holy basil extract, 125 milligrams per day, showed significant reduction in systolic and diastolic blood pressure during and after standardized physical and mental stress tests. Here's another interesting study about ashwagandha. So an extract was used 300 milligrams twice daily for 60 days. And they found, the authors reported, significant reduction in serum cortisol levels, about average of 28% decrease from baseline compared to placebo, and stress and anxiety score improved significantly in the ashwagandha group. I added a citation for you if you want to read further, if you want to read more about it. But those are simple strategies, holy basil for supporting the reduction in the blood pressure, and ashwagandha for helping to support regulation of the HPA axis that we talked about and reduce perceived stress and anxiety. And of course, when your patient is ready for a few dietary strategy, the DASH diet, as I mentioned, which is low in sodium, high in potassium, and phytonutrients, is wonderful. Magnesium taurate, 200 to 400 milligrams. This is a specific type of magnesium that is more aimed towards assisting or supporting with cardiovascular conditions. We have omega-3, 2 grams per day, or 1 to 3 grams per day to support the anti-inflammatory environment. We have phosphatidylserine, which is great to support the regulation of cortisol levels, 200 milligrams in the evening. We have vitamin C, which is essential to synthesize cortisol, 250 milligrams twice a day, and zinc, which is important for HPA axis signaling. And last one is L-theanine, which is important for overall relaxation and reduction of stress and anxiety, 100 milligram per day. Now, you don't have to use all of those. We would typically The more you learn about the integrative strategies, the better you can fit the top 2 or 3 or 4 strategies for each patient. But I want to give you these strategies so you can consider for your patients who are struggling right now in your practice. So I hope you found this to be beneficial with helping your patients with a more broad, integrative, and functional approach. Thank you for watching, and take care, and I'll see you in the next class.